When I walk the streets of my neighborhood, it's not hard to find someone that I know. I look to the park, and in that park is where I learned how to swing. The school is my elementary school, my junior high school. This is my home, this is my neighborhood. I'm not going anywhere. All right, and then bring your peers and maybe we can do something in your school.
Out of 62 counties in New York State, when you look at health outcome and indicators, the Bronx falls at number 62. But you can stop in there any day when school is done. All our services are free. Our goal, our undergirding goal, is to improve the health outcomes of this community.
We're starting to do more things together because collectively our voice is bigger. I got involved with CPHE, doing a community event.
CPHE stands for Community Partnerships for Health Equity. It's a program of MEDICC where we take leaders in a community and their partners to Cuba to see what they can learn from Cuba's healthcare system. The Cuban healthcare system is an integrated system dealing with the social determinants of health, where people eat, where people sleep, where people work, where they play. It has health outcomes that are on par with our own, and its basis is prevention. Along with that is authentic community engagement. What we actually see there are these block-by-block organizations and people really invested in their own neighborhoods.
We have abundance of freedom.
Tenemos abundancia de libertad y de recursos.
And we are not as healthy as you.
Y sin embargo no somos tan saludables como son ustedes.
And we're here to learn how you'll stay healthy.
We visited hospitals, group homes, community centers, daycare centers. Although there are some very real differences between Cuba and this Bronx community, we still face some of the same challenges that they do as poor communities.
When we return from Cuba, we help our CPHE communities identify ways that they can adapt what they've seen in Cuba to their own situation. We want to see implementation.
Hi, how you doing? I'm raising funds for American breast cancer. When I saw with such little resources, the fabulous things that they were able to do, I just thought about it and said, okay, I know even though my community is deemed the poorest congressional district in the United States, we have resources. I've learned that in Cuba and I brought it back to the Bronx. Thank you, Ms. Brown, so much.
My trip to Cuba really grounded me in all the work that we're doing around health. We have gardening programs, youth are conducting youth surveys. We have cleanups whereby residents and professionals within the community are coming together and cleaning our local parks.
We have community partners in 11 neighborhoods throughout the United States. And each of them, like the Bronx, has a project or several projects that were inspired by Cuba.
The empowerment that we're now seeing is that we're able to go look after our own health. And the people are now enriched because they have a new trust in their own community, trust in their neighbors. Therefore, if there's no one here for us, we can maintain a healthy community environment, and it works best for everyone.
Yeah!